Hemorrhoids are swollen, inflamed veins located in the lower part of the rectum and anus. These veins, just like any other veins in your body, can stretch under pressure. Sometimes they stretch so much that the vein walls thin out and get irritated. This irritation leads to swelling, which we know as hemorrhoids. There are two main types of hemorrhoids, internal and external. Internal hemorrhoids are located inside the rectum and are usually not visible or felt. They generally don't cause much discomfort but can lead to bleeding. On the other hand, external hemorrhoids form under the skin around the anus, and they can be quite painful. Believe it or not, hemorrhoids are incredibly prevalent, affecting millions of people worldwide. It's estimated that about 1 in 20 Americans and about 50% of adults over the age of 50 have experienced hemorrhoids at some point in their lives. However, these numbers might actually be on the low side, as many people are too embarrassed to seek medical help for this condition. Causes of hemorrhoids. One of the main causes is increased pressure in the lower rectum. This can happen for a variety of reasons. Chronic constipation is a big one. When you're straining to have a bowel movement, you're putting a lot of pressure on those blood vessels in your anal area. Over time, this can cause them to swell and become irritated. On the flip side, chronic diarrhea can also lead to hemorrhoids. The frequent passing of loose stools can irritate the anal area and lead to inflammation. Pregnancy is another common cause of hemorrhoids. As the uterus grows, it puts pressure on the veins in the colon and rectum. Plus, the hormonal changes during pregnancy can make the walls of these veins more likely to swell. And let's not forget about childbirth itself, which can put a whole lot of strain on that area. Obesity is another risk factor. Excess weight puts more pressure on the veins in your lower body, including those in the anal area. A sedentary lifestyle doesn't help either. Sitting for long periods, especially on the toilet, can increase pressure on the veins in your anus and rectum. Age is also a factor. As we get older, the tissues that support the veins in our rectum and anus can weaken and stretch, making it easier for hemorrhoids to bulge and become symptomatic. Other factors that can contribute to hemorrhoids include heavy lifting, which increases abdominal pressure, anal intercourse, and certain medical conditions that affect blood flow or increase pressure in the abdomen, like liver cirrhosis. Symptoms of hemorrhoids. The symptoms of hemorrhoids can vary depending on whether they're internal or external. Internal hemorrhoids are located inside the rectum and are usually painless. You might not even know you have them. However, straining or irritation when passing stool can damage their surface and cause them to bleed. You might notice bright red blood on your toilet paper or in the toilet bowl. Sometimes, internal hemorrhoids can push through the anal opening during a bowel movement. This is called a prolapsed hemorrhoid. These can cause discomfort and pain, especially when sitting. They might also leak mucus or cause difficulty cleaning the anal area after a bowel movement, which can lead to skin irritation. External hemorrhoids, on the other hand, are located under the skin around the anus. These are the ones that tend to cause the most trouble. When irritated, they can itch or bleed. If a blood clot forms inside an external hemorrhoid, it can result in severe pain, swelling, inflammation, and a hard lump near your anus. This is called a thrombosed hemorrhoid. Other symptoms can include a feeling of fullness or discomfort in the anal area, pain or discomfort during bowel movements, and a tender or painful lump near the anus. Some people also experience a mucus discharge or difficulty staying clean after a bowel movement. It's worth noting that while these symptoms can be alarming, hemorrhoids are generally not dangerous. However, rectal bleeding should always be evaluated by a doctor to rule out more serious conditions like colorectal cancer. Diagnosis of hemorrhoids. When it comes to diagnosing hemorrhoids, doctors typically start with a thorough discussion of your symptoms and medical history. They'll want to know about any changes in your bowel habits, any pain or discomfort you're experiencing, and whether you've noticed any bleeding. The next step is usually a physical examination. For external hemorrhoids, this might simply involve a visual inspection of the anal area. For internal hemorrhoids, the doctor might perform a digital rectal exam, where they gently insert a gloved, lubricated finger into the rectum to feel for any abnormalities. In some cases, they might use an anoscope, which is a hollow lighted tube used to view the anal canal and lower rectum. For a more detailed look, especially if internal hemorrhoids are suspected, the doctor might recommend a sigmoidoscopy or colonoscopy. These procedures use a thin, flexible tube with a camera on the end to examine the inside of the rectum and colon. It's worth noting that while these exams might sound uncomfortable, they're usually quick and relatively painless. The doctor might also order tests to rule out other conditions that can cause similar symptoms, such as colorectal cancer or inflammatory bowel disease. This might include blood tests or stool samples. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for hemorrhoids. The good news is that many cases of hemorrhoids can be treated at home with simple measures. One of the first steps in treating hemorrhoids is to modify your bathroom habits. Try not to strain during bowel movements, and don't sit on the toilet for long periods. When you feel the urge to go, don't delay. Holding it in can make stool harder and more difficult to pass. Increasing your fiber intake can also help soften your stool and make it easier to pass. This can be done through diet, think fruits, vegetables, whole grains, or with fiber supplements. Just be sure to increase your water intake along with your fiber to avoid constipation. Sitz baths can provide relief for many people with hemorrhoids. This involves sitting in a few inches of warm water for 10 to 15 minutes, several times a day. The warm water can help reduce swelling and relax the muscles around your anus. Over-the-counter creams and ointments can also help relieve symptoms. These often contain ingredients like witch hazel or hydrocortisone that can reduce inflammation and provide relief from itching and pain. Just be careful not to use products containing steroids for too long, as they can thin the skin. For pain relief, you can take over-the-counter pain relievers like acetaminophen or ibuprofen. Applying cold compresses or ice packs to the anal area can also help reduce swelling and numb the area. For more severe or persistent cases, there are several medical treatments available. One option is rubber band ligation, where a tiny rubber band is placed around the base of an internal hemorrhoid to cut off its circulation. The hemorrhoid then withers and falls off within a week or so. Sclerotherapy is another option. This involves injecting a chemical solution into the hemorrhoid to shrink it. There's also infrared coagulation, which uses infrared light to create scar tissue that cuts off the blood supply to the hemorrhoid. For very large or persistent hemorrhoids, surgery might be necessary. A hemorrhoidectomy involves removing the hemorrhoids surgically. While effective, this can be quite painful and usually requires some downtime for recovery. A newer surgical technique called stapled hemorrhoidopexy, or procedure for prolapse and hemorrhoids (PPH), is less painful and has a quicker recovery time. Prevention, as they say, is better than cure. Many of the same measures used to treat hemorrhoids can also help prevent them. Eating a high-fiber diet, staying hydrated, exercising regularly, and avoiding straining during bowel movements can all help keep hemorrhoids at bay. Now, we want to hear from you. Did you have hemorrhoids before? Which treatment worked best for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.